Joining me now is president of the Jasser Center for Comprehensive Care, Dr. Zuhdi Jasser. Also with us is internist at Northwell Health, Dr. Frank Contessa. I hope I'm pronouncing your last name, Dr. Frank, properly. Thank you both for being here. So far, the G variant, what many are calling the Omicron, or what Joe Biden calls the Omnicron variant, is far less virulent than previous strains of the China virus. In fact, our understanding is that only one person has died with the new variant, not from the new variant. Nonetheless, Dr. Fauci and his fear porn is being used out there to prompt Americans to get the booster shots. Watch.
But from an immunological standpoint, it could very well increase the durability of protection by things that you can't readily measure by the level of antibodies, that you might have a maturation of the immune system that would prolong the durability. If it becomes necessary to get yet another boost, then we'll just have to deal with it.
Dr. Jasser, with evidence pointing to diminished returns from the vaccines as we get new variants, is Fauci dealing with science here or something else?
He's really dealing, I think, with trying to stay relevant somehow. And also the media finds itself spinning itself into a tizzy about what is really turning out to be just a regular old coronavirus. I'll remind you, the reason this virus was originally as pathological as it was a unique novel coronavirus, which are cold viruses, but because it was novel to human beings, it caused havoc in patients that were vulnerable, which are older patients, patients with chronic illnesses, etc. But as it mutates, it seems to be returning more towards sort of a coronavirus, and it's very mild in its presentation. So the hospital numbers, et cetera. You have even Democratic governors now saying that we should not be under emergency, et cetera. So I think they're finally coming to, they're even starting to spin the other thing, saying they don't want to control what people wear, et cetera, which tells you that they're really more political than any medical science at all involved in their narrative.
Mm-hmm. That's what I'm starting to realize as well. Dr. Contessa, the CDC has been hiding the number of breakthrough cases in the United States. Tell me, is there any scientific reason why the federal government and the Centers for Disease Control should hide this information from the public?
Well, no, of course, they certainly shouldn't hide it from the public. I can tell you that in my community, it's a pretty high rate of vaccination, and we're seeing a spike in cases right now. I had 2 cases yesterday. I had 1 case today, and pretty much everybody is vaccinated. Of course, they should not be hiding the data. It certainly makes you concerned of why they would be doing that. I know that they wanted to seal the data for 55 years, and a federal court overturned that. They're starting to release that data little by little, and some of the data that's coming out is a bit troubling.
No, I agree. And in particular, as to the reactions to the vaccines, you're talking, of course, about the Pfizer data, which led to the emergency use authorization. The Surgeon General, in the meantime, has released a rare public health advisory warning of the emerging youth mental crisis. According to the report, anxiety and depression in young people has doubled since this pandemic began. Dr. Jasser, doesn't government and their enablers in the medical community, don't they shoulder blame for some of the irrational fear, this mass psychosis the country has been forced to endure, courtesy of those irresponsible people I mentioned?
I have to tell you, with 3 teenagers ranging from 13 to 20 in our family, my wife and I have talked about this a lot, and that this is really the crime of what's been addressed. And you and I and others have been talking about this for a year, that there was other pandemics coming after the pandemic, and that we were doing disease trading. And the most vulnerable and I think victimized population are the kids. Why? Because they weren't getting critically ill. We're talking about the Omicron being mild. Even the initial variant of the COVID-19 was not really causing significant illness, but in a few hundred kids that already had CF and other chronic illnesses like diabetes. But the vast majority were subjected to isolation, subjected to social separation, and unable to grow, had to wear masks even when they went to school, and thus unable to be seen by their expressions. And now we're seeing suicide rates up over 50% in teenage girls and up 5% in teenage boys. And that's only the beginning of it, with drug use and other isolation side effects that have happened. So really, the folks that felt that disease trading and obsessing on COVID-19 was the way out of this are should be shouldering the blame for what we're seeing.
Agreed. CNN last week, New York City Mayor Bill de Blasio defended his decision to mandate vaccines for kids to get into restaurants, but not for kids to get into schools. Dr. Contessessa, where's the science behind Mr. de Blasio's decision there?
Well, I certainly think Mr. de Blasio isn't dealing with very much science in a lot of his policies. When we force people into this, I can tell you, just dealing with mandates here, the people who haven't been vaccinated so far, if you haven't had a vaccine right now, most people are coming at this not from a position of ignorance. I'm finding that people that I'm having conversations with who haven't been vaccinated yet have done an enormous amount of research. They've looked into it and they've made their own decisions. And I'm a firm believer in medical autonomy. People have a right to make a decision about their own health. And most of the people are doing that. The 20% or so of people who have decided right now, this isn't a good decision for me. They're coming at it from a position of knowledge, not from a position of ignorance. That's what I'm seeing. I think the unvaccinated are being painted by the media and by the left media as a bunch of ignorant, rubes. And I don't see that at all. They've read studies, they're asking intelligent questions, and they're making their decisions. And people like de Blasio don't recognize that. And to force people into it, you're going to push people farther and farther away, and they're going to become more and more defiant. And they're not going to be part of the conversation going forward of how to tackle this together.
Well, Doctor, you said it. I think people are more qualified to make decisions about their personal health than is Comrade Bill de Blasio, the mayor of New York. Hell, half these people around the country could run New York a lot better than he is. Dr. Zuhdi Jasser and Dr. Frank Contessessa, gentlemen, Merry Christmas. Thank you for being here on the Salcedo Show.